Welcome back. This is Daybreak. Thanks for staying with us. Now, health and lifestyle. With me this morning in studio is Dr. Abdallah Ziraba, who is an epidemiologist and a medical doctor. That is research scientist, currently serves as the chief of staff at the African Population and Health Research Center. We'll be focusing this morning here on the broadcast on the measures taken to combat TB. Kenya remains among the 30 high-burden countries for tuberculosis, highlighting the need for continued efforts by different state agencies. In 2023, 124,000 cases were reported, along with 15,000 deaths, making TB one of the leading causes of deaths in the country. Daktari, thank you for your time.
Thank you for
much appreciated.
Thank you.
How key is the messaging around this?
Yeah, TB is still a major public health issue, and you might have watched the proceedings on the World TB Day, talking about the numbers. For example, about 133,000 new cases every year. And that's not a small number. And being on the list of the 30 high-burden countries says something about the current status of TB in the country.
All right. And what are the measures taken? Because this number seems to be big, 133 per year. Yeah. Last year we had 124. Relatively, the number seems to be matching up. Yeah,
the numbers seem to be oscillating, because not many years ago, the numbers were about 150,000 new cases per year. And these numbers sometimes are a function of how efficiently we are identifying these cases. But the most important thing is to look at what we're doing. And TB is a major public health issue, and it has to be addressed at all different levels, including prevention, identification of new cases, early initiation of treatment, and following up to ensure that people who are on treatment are getting the right treatment and getting the right results, and also ensuring that the systems are in place to support those operations. As you can imagine, it's a whole system, from prevention to treatment and addressing the complications that might arise.
And you previously worked with the United Nations funded program for tuberculosis. Given the infrastructure around healthcare across many sub-Saharan African countries, including Kenya, is the response relative to the growing number of cases reported annually?
I think until the current crisis we are in, the funding cuts, a lot of people had not realized how expensive it is to run a disease program like TB. It costs a lot of money, and a lot of investment need to go into this. And we are realizing this quite, for many people, it's coming as a surprise that we seem to be in trouble, because with the donor funding out of place or withdrawn, we have a challenge funding the TB response using national resources. We have a weak healthcare system, whether you're talking about the delivery systems for vaccines, whether you're talking about healthcare workers, whether you're talking about availability of vaccines and medications. All those have been supported to a very large extent by donor funding. And if that is withdrawn 100%, it leaves a huge gap that needs to be filled with resources from somewhere.
What are we looking at in terms of then the bearing this will have on healthcare systems and the funding gap that it will result in?
One, the immediate ones, for example, we've seen healthcare workers, including community workers, have been laid off, those who have been supported by the donors, and these people have a function. In the current strategic plan, Kenya emphasizes the community approach, where the benefit is to identify cases early, so that they are treated before they become contagious. So with that withdrawal, it means that a lot of people who have been supporting provisional services are going to be out of jobs. So there will be shortage of service providers. There will be shortage of supplies, including diagnostics. There will be shortage of drugs, and there might be a shortage of management of complicated cases. So unless there is really a very well thought out plan to plug that gap, including austerity measures, because yesterday I was looking at the analysis of the impact, and one of the things that caught my eye was that there was little mention on how we can minimize the way we spend resources, because sometimes when you're constrained on resources, you can use the little that you have more sensibly. So can we become more more pragmatic in terms of how we use our resources.
Yeah.
Because we all read the stories that there's a bit of wastage in the systems, and if we could become more efficient, probably we could get better value out of the resources that we have. Okay.
And given that the country joined the rest of the world in marking TB Day about 2 days ago, and certainly, what were your key highlights? And as stakeholders, did you also convey the importance of such austerity measures for cash to be now diverted to the much needed sectors in the healthcare system because of the funding cuts?
Yeah, of course, the 24th was the day to commemorate, but the whole week we're talking about. That's the reason why I'm here today. Yeah. And we have different spaces through which we voice some of these ideas, and we will continue talking about these ideas. But the most important thing that is happening this year is that the TB response has been dampened because of the cuts. A lot of the funding that comes to Kenya and a lot of other countries is donor money. When you're looking at TB, whether you're looking at malaria and HIV, those three diseases are majorly funded by the donors. And any cuts from those sources leaves a very big gap. So this year, it has been sort of a challenge looking at the ambition that we have, achieving the goals by 2030 or 2035. And then it raises the question, are we going to remain on track? Yeah. And maybe the first 1 year of this particular event is going to give us an idea of whether the cuts are going to derail the achievement of the goals that we have. Yeah. Of course, we already had challenges in achieving those targets, but there was hope that a lot will be achieved by 2030.
Yeah. And in the evolution of TB from your studies, what factors come into play, and what's given what normally happens in this particular case, looking at some of the issues that you have highlighted, what are the critical challenges also in that process and treatment process, to be specific?
Yeah. Okay, I think the first thing is really prevention. Prevention is very, very important. A stitch in time saves 9. Yeah. So childhood vaccination is very, very important. The good thing and the good news is that coverage in Kenya is quite high. Over 90% of children under 5 are vaccinated. So, very, very important.
So before the age of 5 years?
Yes. Okay. The second thing is early detection of suspicious cases. Mm-hmm. Early detection means that you catch this person who might have TB early before they transmit to other people. There's a problem of the individual who is affected, but also the community. If you don't catch this person early, they're going to make the household members get infected, or the community at large. So early detection is very, very important. The third is early initiation of treatment and the right treatment. If somebody has been diagnosed with TB, no shortcut, no two about it. Yeah. You need to start on effective treatment. If you have situations where you have drug outages, then you have a problem on your hands. The other thing is really to monitor development of resistance. We know that these drugs are very good, they're effective, but we have situations where some of the drugs are becoming ineffective because of the strains that are developing in the communities.
Mm-hmm. And are there the specific factors that, in this case, you would advise in terms of the do's and the don'ts?
Yeah, I think the most important thing is really to sensitize the community to know that TB is there, and TB gets transmitted between individuals, and TB can be treated and cured, and TB is not shouldn't be seen as a social outcast kind of thing. We have something we call TB-related stigma, whereby if somebody has TB diagnosed by healthcare workers to have TB, they are seen as an outcast, and many times people prefer not to disclose or to even imagine a diagnosis of TB. So if we can address some of those challenges, of course, addressing the health system challenges, I think we'll make some progress.
Okay, and during in the 24th that you attended the world, when Kenya is part of the world marking the TB Day, of course it's an exercise throughout the week. The government also had laid out an expanded TB treatment coverage with a goal to increase coverage from the current 32%, which was by the year 2021, to 80% in the year 2028, in about 3 years' time. Mm-hmm. Is this achievable?
Yeah, it's good. It's always good to have targets. Some people think it's very ambitious. Some people think we need to have that target so that we work towards that target. I think for me, the most one thing is to do all the bits that we ought to be doing. We need to do something on prevention. We need to do something on early detection, something on early treatment, and strengthening the system to support all those processes. Slogans on commemoration days are very important. Setting targets are very important. But without doing the real dirty hard work, it's very difficult to think you'll achieve those goals. But it's always good to have targets.
But then again, how best is it? Because we have talked about the funding cuts here, and these comorbidities are very critical in a population setup. So what numbers, for example, in the Kenyan context annually are we looking at for these deaths as a result of TB?
I don't remember the numbers offhand, but the numbers have come down a bit. What I remember is the number of new cases, which is about 133,000 new cases in a year. And you mentioned that the year before it was about 124. So the numbers are sort of going down and a bit stable, but we don't know which direction to take. And it would be nice to have data systems that can capture the numbers so that we know what's going to happen in the next few years and prepare for it.
And here then in this case, are there cost factors that probably the viewers can look out for, and between, of course, different demographics, includes children, you said vaccination is key, also in older people or the adults. Are there the cost factors?
Yes, of course, there are people who are more vulnerable to TB than others. We've talked about the children. We talked about people who have HIV. They need to be given preventive treatment. We have people who have other comorbidities in the communities, the older people, and the people who have been exposed by virtue of the fact that you've probably been living in a household where somebody has been diagnosed with TB, or you've been at a workplace, you share an office with somebody who has a diagnosis of TB. You need to be screened and given treatment so that that risk is minimized. So a lot of things can be done, but different pieces have to be put together to move forward.
And what is happening from your end in terms of research and the goal towards public engagement to help Kenya and other countries across the globe get the local and global TB targets? I mean, how much of an effort is going into that?
I think the beautiful thing is that most of the tools needed to control TB are known, or they're in place. We talk about the vaccines, we talk about the treatment, we talk about the thing that is really holding us back is scaling to capacity. If you have pockets of people who are not vaccinated, if you have pockets of people who are living in crowded environments where transmission is high and they are not being detected, they are not being screened and detected early enough, if you're having people who are not adhering to treatment and we're having situations of developing resistance, then that's really a challenge. So the most one thing is really to scale whatever we have, the tools that we have. Even before talking about new vaccines or new technologies, those are appreciated. But if we can take to scale what we have, we can dent, we can move the needle in terms of prevention.
Given that you have mentioned capacity aspect, how much of it is personnel and how much of it is the system that needs to be set up to combat the cases that you have said? Yes, of course, lessening in terms of the number of deaths, but increase in terms of the number of reported cases.
Personnel is part of the system, and you need the numbers, you need the health providers, you need the people who track the community health workers who track cases and do the initial screening. But we need the hardware systems. We need the machines, for example, gene expert machines that can be used for in the diagnosis of quick diagnosis of TB and screening at community. We need to ensure that there are no disruptions in availability of medications. If somebody is on TB treatment, they should be on treatment for the period. If it's 6 months, they need to be on treatment for those 6 months without interruption. Otherwise, you end up with challenges like development of resistance. So systems are all the way from personnel, all the way from the community to the most complicated. I think maybe the question would be, where do we emphasize? And for me, I would go for the community, component, because that's where the cases are. And if you get new cases that have not been identified, not given treatment, the multiplier effect will come into play and you'll have more cases. And like I said earlier, a stitch in time saves 9. If you catch them early. So
you're talking about sensitization and the need for
sensitization and
awareness campaigns.
Awareness campaigns, screening for those who are highly vulnerable and those who have been exposed, and making sure that there is follow-up to ensure that they get treatment and they follow through with the treatment.
And we had recently seen the community health promoters who have been brought on board by the government. Of course, largely their welfare coming from the counties and the national government. How a key cog have they been in the spreading of the same message on awareness and sensitization amongst the communities?
I don't have the numbers on their impact, but they're a central cog in that wheel, because the frontline workers, they know what's happening in the community. They talk to the people in the community. They may know who has what kind of challenges. So for me, the issue, I think, around community health workers has been how to sustain them, how to motivate them to keep working. Because previously, they have been, like the name suggests, volunteers with no particular entitlement to benefits and financial support. So if that can be sustained, but it costs money, and we're talking about thousands of them, and as to whether the government can pay, that's another question. Yeah. And if we can't pay, probably they will not continue working. Yeah.
Can we meet the World Health Organization End TB campaign by 2030? Given the funding cuts that you have mentioned, given the personnel disruptions, and the large number of people you intend to, of course, reach because of tuberculosis?
It's a tough target, a tough goal, and it has been tough even before the cuts. And with the cuts, my prayer as an individual would be not slacken. If we can sustain the momentum that we have, for me, I would consider that as success. There's a huge risk that we will slacken and backslide. And we know that TB mortality in the early 2000s associated with HIV was quite a huge public health issue. Yeah. And I shudder going back there. And we are talking about TB here, but we have the cousin now, that's HIV. Yeah. And TB and HIV tend to move together. And if the cuts have been made for these two conditions, it means that TB is going to shoot up because HIV is gone up.
Yeah, because you also mentioned vaccines as one major preventive way. And recently we also had reports of vaccine shortages in the country. Did this
before the cuts?
Yeah, did this also affect in this part, TB vaccines?
Yeah, we don't know yet. Vaccine access is a complicated setup facilitated by Gavi, and Gavi doesn't have its own money. Yes. Gavi is also supported by the US government. I'm yet to get the numbers of how much cuts Gavi might encounter and how that will translate into the national access programs. But I know that Kenya, to a large extent, puts a quite substantial amount of money in vaccine access. So I think this is a top priority for the country. I don't think we'll make a mistake of cutting or slackening on accessing vaccines. I think that will be a huge one. Yeah. So I really think that vaccine will continue to be available.
Yeah. Are the cuts by the American government a blessing in disguise, given what COVID had taught the world, that dependency is always the best strategy? I mean, the world was literally falling over because of personal protective equipment, PPEs, and you had seen how the shutdown of the airspaces and export and import was equally affected. Should this be a wake-up call as well to set up our healthcare systems?
Yes, I think you're right. This is a wake-up call to say we need to put our house in order. We need to manage our affairs. We were concerned that we were mistreated during COVID because we were second-rate world citizens, because we got vaccines late. We were not prioritized. And here we are again. Our systems are, to a large extent, funded by donors whose priorities can change after every 4 years, like the case of the US. We've seen other countries, including, I think, the Dutch government, also talking about cutting funding to some areas. So this is something that we need to really think critically about and make sure that we live in our own means. We build systems that are responsive to our needs. We manage those systems. Previously, I think most of the agenda has been set by the donors. We want to do this, and the government follows it, rather than the government setting the agenda and the donors fitting in. Yeah. They say who pays the piper calls the tune, but that situation needs to change, where we need our own agenda set, and it's okay to have somebody helping you. Even rich countries get aid. Yeah. Israel get aid. They get aid from the US. Other countries like Egypt, they get. I mean, aid is not a bad thing per se, but where it makes you relax and sit in your comfort zone, knowing that from the tax money, after all, the donors are going to fund, for some countries I won't mention, the HIV budget is as high as 90%. So how do you rely on donor money? How do you rely on your neighbor to address the affairs of your own household? So in a way, it's a good wake-up call. The only problem, the way it was done, it was so abrupt, malicious, and we could have had maybe a transition period. Say, look, in the next 1 year or 2 years, you need to transition. We need to transition. We are not going to give you 1, 2, 3 things, and that would have been better. But the way it is, it's what it is, and we need to pick it from there.
And as hawkish as Trump could be, and any other government would be, and talk has been about seeking alternatives, including turning to European countries. But again, you see, Europe is more concerned about its defense, its healthcare, and America is, of course, now looking inward. I mean, should this be a very serious endeavor that we need to embark on healthcare and education and other important matters? For example, you have been based in the UK for a very long time, and you have seen how the NHS works for the folks over there.
Yes.
How can that be a better lesson than depending on the money that comes into the pool where we dip our hands in?
You said earlier that should this be a wake-up call, and I said yes, because we shouldn't be looking for alternative funders. We should be looking for better ways of doing our own thing. We should be looking for better ways of fitting within our own budgets. Of course, if we have a helping hand, that should be appreciated. We shouldn't be thinking that Europe doesn't have problems. Europe has problems. If you look at the right side of the political wing in France, in Germany, they are not much different from what the sentiments they are not much different from the sentiments that we're seeing in the US. They are becoming more inward looking. They are saying we have our own problems. Why think about those other people? So we are not going to be developed by China, by Europe, by the US. We need to do it ourselves.
Yeah, and here you said the case of Peter and Paul going together at the same time, comorbidities you talked about, HIV and tuberculosis. And how do we then strengthen and have an integrated system where this can be handled in the double way that you talked about? Because I'm seeing there is a proposal to raise the treatment coverage from 63% to 80% and case detection from 69% to 80% by 2028. That's an ambitious goal. How do you attain that?
Very ambitious. Very ambitious. My advice would be, let's start looking at healthcare system as a whole system. Let's stop looking at vertical programs that have been given a lot of money. If you're in the Ministry of Health, you would hear certain programs complaining that they are not well funded because the donors are not interested in neglected tropical diseases like cysticercosis, and they hardly have any money to operate. So my proposal would be, let's operate as a system. Let's avoid the verticalization of programs. If a patient goes to a health facility, they should be seen as a patient. They should be screened for TB. They should be screened for diabetes, because these two are not mutually exclusive. The problem we've had is looking at programs based on who funded what. PEPFAR says this is money for HIV or TB. You shouldn't touch this drug because this drug has been funded for HIV. That has been part of the problem. We are not in the driver's seat.
Yeah, and because PEPFAR has been also one of the major funding programs, now it's no longer there. We talked about the need to reinvent our healthcare systems. But looking at the country, which has also recorded 41% reduction in TB incidence and a 60% reduction in deaths, but the number globally is still 1 million per year. So Kenya can do its part, but there are other sub-Saharan countries or countries in the continent that may not have the economic muscle to set up systems that may well respond to these problems at hand. So what will be your reach as an organization or as an individual?
Yeah, the African Population and Health Research Center works in over 30 countries. We have physical offices in Kenya and Senegal, but we work through partnerships with other countries. And health challenges are not a one-country challenge, and especially when you're talking about infectious diseases, they don't respect borders. If you have TB today, you catch a flight to go to London or to go to Zimbabwe, you expose people on that flight, and it's a very big problem. But I want to just make it clear that TB is not just an African problem. TB, I would say, is a poor country problem. India is one of the countries with the highest number of TB cases. And partly because of the economic situation there, the overcrowding, the living conditions that people live in slums just makes transmission
easy,
very easy, and then the system cannot catch up with the detection and treatment of those cases. So it's really a global health issue. And I think in the fullness of time, the US will need to sit back and say, well, we are being inward looking, but does this make the US safer? Because if you look at the aid budget that the US spends, what is the percentage of that to their GDP? Quite a small percentage. And if they are to look at the potential benefits, maybe they need to do some math and see. And I'm not saying that they should give us free money, but I think it might be in their interest to attend to some of these global issues that do not respect borders. Yeah,
because if you look at the global efforts to combat tuberculosis, 79 million people and lives were saved. Now this is going to be a journey without America, unless the policy changes at the White House, given Donald Trump's unpredictability and the hawkish nature in which it treats such endeavors that America has been funding. How then will the world position itself, minus America, with programs that will help in, getting to people who have been affected and the thousands who are on their beds and need urgent treatment?
Definitely the world needs to move on, with or without America. It would have been better with America on board, but I think what we need to do is to do more with less. Let's be more can I say, more cautious about how we use our resources, how we apportion our resources. I think being a resident in Kenya and reading newspapers around Africa, you hear a lot of money being stolen from, for example, ministries. And you're wondering, how can somebody steal from the poor who are dying? And sometimes you have also to empathize with the taxpayers in those countries. When they come here, sometimes they shudder at how careless we are with the use of resources. And a lot of people who have been caught have not been put to task to explain why the resources have been misused. And I think if we become tougher on that front, maybe we can do more with the less resources that we have. But we cannot sit back and say, until America comes back, because we don't know who is going to be the next president of the US. He might be from Trump's school of thought, and that might be another 80 years of us working without the US. And probably, like you said earlier, it's a blessing in disguise. We need to own our own burden. We need to, like people say here, we need to carry our own cross.
And because your area also extends to maternal, newborn and child health, HIV and AIDS and reproductive as well. So, of course, here we have different peoples. For the case of expectant mothers, breastfeeding mothers, and there is a question here which basically focuses on breastfeeding mothers who are TB patients. Can they breastfeed?
Yes. Breastfeeding is very safe, very good for the baby. If you do not breastfeed as a mother, chances of survival of that child are going to be very low, and chances of getting malnourished are going to be very high. And a malnourished child has a very high risk of getting TB. Just to make the connection. If a child is malnourished, higher chances of getting TB.
All right. And how about the case of reproduction, expectant mothers?
If you diagnose with TB, the treatment is generally safe for you to start treatment. TB, there's no waiting. So anybody who has symptoms of TB needs to be screened, and they'll be given the right advice on what kind of regimen they need to be taking.
And also this final one, it's on the newborn babies.
Usually newborn.
Are they susceptible?
Usually towards the end of the first year of their lives. When babies are born, they are born with what we call maternal antibodies. And those antibodies are the soldiers to fight against any infection. Those antibodies are produced by the mother and they are passed on to the baby. And for the first 1 year, they are really very helpful in protecting the child. But usually, toward the end of the first year, if a child has been exposed, they can show signs and symptoms of TB, and they can develop TB disease.
Okay. And this year, the theme has been the commitment by countries, including ES, which was themed, we can end TB, commit, invest, deliver. What then would be your clarion call here, beyond the commitment and the general acceptance that it is a problem, but to the action point itself of proper investment and the need for proper personnel who need to be brought on board for proper demographic surveillance?
The slogans are very good for mobilization, but they don't get the work done. They can be useful in sensitizing people, actors, including funders, but we need to walk the talk. My clarion call would be, under the circumstances, we need to do better in terms of maximizing the efficiency of the use of the resources that we have. Yes, we can, but we cannot do it without doing the hard job.
Yeah.
And that involves making sure that everybody involved does their part, including the communities, the healthcare workers, the politicians, making resources available, and the healthcare service providers, making that those resources entrusted to them are put to good use.
Yeah.
At the end of the day, we should see change.
Yes. Is this a problem largely attributed to the developing world, or it's a case equally where developed world equally is battling with?
You mean TB? Or?
Yes, TB, yeah.
TB has been around for a very long time, and about maybe 100 years ago, Dr. Robert Koch discovered the germ that caused TB. Initially, it was considered to be bad air, a lot of other things.
Yes.
So TB is not an isolated African case, but it has become related with underdevelopment. It's a disease, right now, you can, with a lot of certainty, it's like a disease of poverty. Because if where you live can determine whether you get TB, you can imagine if your house is not ventilated, you have a visitor for 1 hour who has TB, he leaves the germs flying around and you get TB. So it's not an African problem, but the risks are higher in Africa.
Okay.
And even when it happens, the responses are not as important as they should. I remember when I was traveling to the UK for studies, one of my friends traveling from Kenya was required to do TB screening test. And because he was coming from a country that is listed among the high burden countries. So the difference is how the countries respond to the threat. But the risk is always present around the world. For
the case of India, you talked about the demography and overcrowding, which is majorly a problem in cities like Mumbai and Delhi. In the case of Africa, is the tropical climatic condition a contributory factor?
Not at the top of the risk factors, no. We have countries that have hotter weather, but they are not having as much problem as possible. I mean, as we have in Kenya. And besides, if you're in an environment where you're spending so much time indoors, for example, in the northern hemisphere during winter, people are indoors, and that's why we had a lot of COVID issues. That would be a very big problem for them. So it has nothing to do with the hot weather. It has to do with how we respond, the nature of housing, the nature of vaccination program, the nature of treatment, identification and treatment of cases. Those are the most important drivers.
Okay, and also another question. What are the signs that I should look out for?
You can get a TB germ and you don't get symptoms. And the germ lives in your body, and that's called latent infection. But if the germ gets into your body and it starts multiplying, you start getting symptoms. And some of these symptoms, it depends on where the germ has located itself. One, we have what we call pulmonary TB, that is TB of the lungs. And there is another type we call extrapulmonary TB, TB that can affect the bones, it can affect the lymph nodes and other organs. But more specifically, more generally, some of the symptoms that present, if it's TB of the lungs, cough is a very cardinal symptom. It's a very important symptom. Fever, that is a high body temperature. Temperature that is higher than normal. Losing weight unexplained. You're a normal person, you're 60 kg, and all of a sudden you got 45, and you have these other symptoms. That is something to worry about. Other symptoms include night sweats. A normal person shouldn't regularly sweat at night unless you've over-applied warm coverings. that's another sign that can be useful.
Daktari, much appreciated for your time.
Yeah, thank you so much for having me.
Much appreciated. Dr. Abdallah Ziraba is an epidemiologist and a medical doctor, research scientist, currently serves as the Chief of Staff at the African Population and Health Research Center. Many thanks for your time.
Thank you.
So we cross over to the College of Insurance, where the selection panel of the IEBC is conducting day 3, which is